Thank you for being here this afternoon. I appreciate it. It's great to be here with all the other authors and the audience members. Stephen, thank you very much. Our world, we live in a turbulent world. There's so much going on right now. You could turn on the news and see all these crazy things. Honestly, I stopped watching news on a consistent basis 21 years ago during the O.J. Simpson trial. I just got tired of watching it. It's too depressing. There's many things that we can do instead of being depressed or being mad by watching news on a consistent basis. One of those things is to pick up a book. Pick up a good book, escape from all the turmoil that's going on in the world, enjoy yourself. Another thing that we can do is exercise. Motion is one of the foundations of health. One of the fundamental things that we can do to help ourselves be healthier, fitter, and improve our everyday function. Many people throughout history have exercised. We all know that. Next month is the Olympics. We're going to see some of the best athletes in the entire world. We're going to see them in all types of different events. People throughout history who have done some very basic things who have helped them. When I think about these folks, I think about Winston Churchill. Winston Churchill, whenever he had to make an important decision, he would go for a walk. That was one of the things that he enjoyed doing. He would go for a walk with one of his other political friends or maybe one of his family members and would help him to think clear. Another person who did that was Albert Einstein. We all know Albert Einstein was a genius. We all know all the incredible scientific things that he thought of. Albert Einstein used to go for a walk with his science friends. And while they were walking, they would come up with all these different ideas and they would be very creative. Now, I don't know if these two gentlemen knew the physiology behind what they were doing, but they knew the benefits behind exercise, behind motion. The physiology behind it is very simple. The physiology is that our heart rate goes up when we start moving. We start to breathe a little bit heavier. So what does that mean? We're getting oxygen into the body. And when our heart is pumping stronger, it is bringing oxygen throughout the entire body. One of those areas is the brain. It helps us to think better. It elevates our mood. It gets us away from all the things that are going on in our world. It puts us in our own individual world, our own personal world, where we are thinking about all the things that are important to us. Ladies and gentlemen, my name is Donald Ozello. I'm a doctor of chiropractic. My office, Championship Chiropractic, is about to celebrate my 10-year anniversary here in Las Vegas. September will be my 10 years of being open. My book, Running, Maximize Performance, and Minimize Injuries, is something that started as a series of articles and then morphed into a book. It is based on the most common injuries that I see in my office all the time. Low back pain, sciatica. A side note about sciatica, one of my patients years ago, she said to me, she said, "Doc, sciatica, if sciatica was a female, sciatica would be a bitch." And I looked at her and I said, if sciatica was a male, sciatica would be a son of a bitch. And she went, "Oh, Doc, that's funny, but don't make me laugh. It makes it hurt worse." But that's just one of the many things that I cover in my book. My book is a collection of strategies and techniques that individuals can do who exercise, who are runners, who are walkers, who are competitive, who are recreational runners, people who just want to improve their everyday health. They may get out and walk a mile with their dog every day. They may be training for a half marathon. They may be training for an ultra marathon. They may be one of those vertical runners that run up the stratosphere every year. It doesn't matter what type of athlete that they are, what type of runner that they are. My book covers techniques and strategies that I have learned throughout my years of practice of how people can prevent injuries and how people can manage injuries. It also contains many things of all the research that I've done. I realized when I graduated from chiropractic college 20 years ago that I needed to keep up on all the information that was being put out there. Because if I didn't, I would be teaching things that I learned in the early 90s. Okay, I graduated from school in 1995. So what I did was I continued to learn. To this day, I still study, I still do research. I teach chiropractic continuing education webinars. I teach in the sports medicine department. It helps me to really learn and look at the newest research that's going on out there. This research helped me when I was writing my book, gave me a lot of information that I use to treat my patients. I mentioned 2 of the chapters before, low back pain, sciatica. I cover a wide range of things, from hip flexor injuries to the groin pull to knee pain, a variety of conditions that involve the knee, a variety of conditions that involve the ankle. One of the things we always hear about during football season is a high ankle sprain. People ask me, Doc, what the heck is a high ankle sprain? What is the difference between a high ankle sprain and an ankle sprain? And so I tell them all the details on it. And that's one of the chapters in the book is a high ankle sprain. But it's not only what it is, it's the anatomy behind it. It describes in detail how you can prevent those injuries, strategies that you can implement in your training and in your everyday life. It also contains methods that you can use to rehabilitate yourself from these injuries. If we do get these injuries, they're going to happen. If we get it, what we want to do is do everything that we can in our self-treatment and in our professional treatment to recover from that as comprehensively as we can, as quickly as we can. But the main thing is we want to get back to our competition. We want to be able to achieve our goals, and we want to be able to prevent a recurrence of these injuries. One of the injuries that I see all the time in my office, that is one of the most common injuries that occurs in athletics, is a hamstring strain. The hamstring strain is actually the longest chapter in my book because it is so frequent. And there's so much information out there that athletes can do to help themselves. In my book, not only do I have the writing, but there's illustrations that I have done, and there's also QR codes to videos that I have done. There's at least 10, I think there's 13 QR codes to videos that I have done that goes over in detail things that are covered in the book. One of the things that I love to do is I love patient education. Patient education is so vital, and that's what this book is. This book is going to help individuals of all levels, of all sports, of all ages, to prevent injuries, to rehab injuries, and to accomplish their goals, to help themselves feel better and be able to do the things that they want to do. Many years ago, the godfather of fitness, Mr. Jack LaLanne. We all know who Jack LaLanne is. Jack LaLanne was an incredible man. He could do push-ups, he could do pull-ups, he could do so many things that individuals half his age could not do. But a long time ago, Jack LaLanne said, exercise is king, nutrition is queen, put them together, and you have a kingdom. I am here, ladies and gentlemen, to help you build that kingdom, to help you maintain that kingdom. My book, Running, Maximize Performance and Minimize Injuries, has many different strategies, many different techniques that can help folks do that. Donald Ozello, Doctor of Chiropractic, Championship Chiropractic, Running, Maximize Performance and Minimize Injuries. Thank you very much, folks.